Welcome back to Washington Watch. Here are 3 facts from the Centers for Disease Control and Prevention. African Americans are the racial ethnic group most affected by HIV. In 2009, African Americans comprised 14% of the U.S. population, but accounted for 44% of all new HIV infections. The estimated rate of new HIV infections for black women, more than 15 times as high as the rate for white women. With these numbers, HIV-AIDS affects a large part of our community. So it's important to question politicians about how they plan to better serve our community before giving them our votes. So what's the ask for people living with HIV and AIDS? Here to talk about that is colleague Lindsey, Director of Legislative and Public Affairs for the National Minority AIDS Council. Welcome to the show, Doc.
Thank you, Roland.
Let's get right into it. First of all, huge issue. The face of AIDS today really is a black heterosexual woman.
That's right.
And so from a public policy standpoint, what should African Americans be telling the president, be telling Mitt Romney, members of Congress, people who are running for governor and state rep, state senate, even local folks, city council, when it comes to this issue in our community?
There are so many people within our community, certainly among the most affected groups, which are the younger populations, those that are under 30.
Right.
Those individuals are the largest proportion of individuals that are without health care. These individuals are going to need access to health care to get access to those very important medications that will help them protect the health of their partners.
One of the other issues that I've talked with over the years with African American AIDS organizations is that the reality is the infrastructure, if you will, has always been tailored around that of white gay men.
That's right.
It's part of the ask also to say, look, put the money where the greatest need is versus what has been the historical need.
No, absolutely. I think that was very clearly articulated in the U.S. National HIV-AIDS strategy that the president released in June of 2010. He very clearly said that the money should be allocated according to the epidemiological statistics. So in communities where HIV is running rampant or where people are being disproportionately impacted, it is a responsibility of both the federal and state government to direct their public health resources to respond to that need within those communities. That's the charge of the National HIV-AIDS strategy, and I think it's the responsibility of elected officials to make sure that that's carried out.
About 30 seconds left. If there was one more ask that folks should be making, what is that specific ask?
The ask is to exert the kind of leadership, direct the appropriate resources, and drive home science-based policies that we know work, that have been proven through rigorous randomized control trials or even through efficacy trials in communities. Implement science-based strategies to end this epidemic once and for all. Create an AIDS-free generation.
All right, we certainly appreciate it. Thank you very much for being here.
Thank you.
All right, folks, you can tell us your thoughts on what's the ask by logging on to tv1.tv/ask. And again, we'll read your comments, and hopefully others will do so as well. Up next, she is brassy, she is outspoken, and she also has a new book that is pretty interesting with a very interesting title. Up next, conservative Meghan McCain, the daughter of Senator John McCain.